about electrophysiology. Electrophysiology is one of the most useful tools that we have in audiology, and NB Hearing is able to offer that to you. It consists of multiple tests battery, which read the electrical activity of the brain in response to sound. So we are able to effectively measure how sound actually travels through the brain. A few of the tests that we're able to do, and it's not limited to these tests, are called Otoacoustic Emissions, or OAEs, which actually read the activity at the cochlear level, so the hair cells in the actual cochlea. Electrocochleography, or ECOGs. Auditory Brainstem Response testing, which reads the neural pathway of the auditory nerve. And auditory steady state response testing, which is able to accurately estimate a person's hearing. In order to test the auditory neural pathway, we do need to limit other sensory input. So we need a patient to either be under natural sleep for this test, or under sedation or anesthetic if they're not able to be tested under natural sleep. This may sometimes require a hospital admission, and tests can be done in theatre due to the anesthetic. The reason why we need a person to be asleep is we need to accurately assess the auditory pathway in isolation from other sensory inputs. So it's best to test the patient. So how do we do this test? It's a very non-invasive assessment. It's not painful at all, and it requires electromagnet stickers, so just stickers that we stick on the forehead, the cheek, and the neck. And then we put foam earplugs into the ear, which deliver sound. The electrodes record the electrical activity from the brain through the person's skin, and the probes in the ear actually deliver the sound to the ear. So what are the benefits of these assessments? We can identify exactly where along the auditory neural pathway a pathology might be sitting. So, for example, a person who might have had a minor stroke, or some sort of neurological activity going on at the brain level, we're able to identify exactly where along the auditory pathway a problem may lie. And that allows us to make a more appropriate referral to other professionals. If we suspect that a patient might have had a stroke and they have the scans might not be picking up on a stroke, we can assess and we can refer further on to a neurologist or other professionals that might be able to assist. We can determine exactly the cause of hearing loss. So is it nerve related? Is it cochlear related? Is it brain related? And we're able to exactly pinpoint where those markers lie. The testing is very quick. It's accurate, it's reliable, so we don't have to rely on a person's behavioral responses. For example, in children, often their responses might be questionable because it really requires them to concentrate, attend, and respond to sound quite accurately. And sometimes it's just not possible with certain individuals. So this testing really gives us a very reliable and accurate representation of someone's hearing. Depending on what problems we may detect, we can refer to more appropriate professionals, as I said. So for example, if a patient has any other neural involvements or needs to see an occupational therapist or whatever it may be, those referrals can be made. And this allows us to also accurately help and assist our special needs populations. If you think about a child with any developmental, neurological, or physical impairment who are not able to accurately respond to a normal hearing test, this allows us to serve that population and really assess whether it's a hearing issue or whether it could be another developmental or neural difficulty that they might be experiencing. And we are then able to give them the appropriate treatment much faster. We're also able to use electrophysiology testing in our newborn hearing screening, which is pivotal to early intervention in children. The earlier we can identify hearing loss in a child, the earlier we can give them the most appropriate treatment going forward. So just to summarize on electrophysiology, it's a very quick, non-invasive procedure. It does require a patient to be asleep, sedated, or under anesthetic. We're able to record the brain's activity in response to sound, and that gives us a real accurate measure on a person's hearing ability who otherwise wouldn't be able to respond to a normal, conventional behavioral auditory assessment.